Now let's talk about diagnosing a patient with hypertension. Systematic screening is recommended for patients over 30 years old, diabetics, and pregnant women. Hypertension may be indicated by neurosensory signs like headaches, buzzing, or tinnitus, which refers to perception of sounds in the ear or head without any external sound source. Three measurement methods are utilized to measure the blood pressure. First, clinical measurements. The patient is in semi-seated or lying down position for at least 5 minutes, and the blood pressure is measured in both arms, repeated multiple times at heart level. Hypertension is diagnosed if the blood pressure readings are equal or greater than 114 systolic or 19 diastolic. Secondly, ambulatory blood pressure monitoring. This method provides comprehensive information beyond clinical measurements. It assesses blood pressure over a 24-hour period. ABPM enables the comparison of daytime and nighttime blood pressure, with a normal decrease of at least 10% during the night. This method distinguishes three types of subjects based on their blood pressure patterns. Diapers experience a decrease in night blood pressure. Non-diapers exhibit no significant change in night blood pressure, and risers encounter an increase at night. It is important to note that nocturnal hypertension is more severe and carries a higher cardiovascular risk than daytime hypertension. Hypertension is diagnosed if the 24-hour ABPM readings are equal or greater than 113 systolic or 18 diastolic. The third method is home blood pressure monitoring. This method involves taking 3 consecutive blood pressure measurements for 3 days. Hypertension is diagnosed if the blood pressure readings consistently remain above 135 systolic and 85 diastolic. Hypertension, if left uncontrolled, can lead to various complications affecting different organs and systems in the body. For example, in the brain, hypertension increases the risk of developing cerebrovascular disease, with ischemic strokes being a significant concern. In the eyes, hypertensive retinopathy is a condition characterized by damage of the blood vessel in the retina of the eye, leading to vision problems and in severe cases even vision loss. In the heart, hypertension puts extra strain on the heart, which can result in severe cardiovascular complications. This include chest pain, heart attack due to the blockage of blood flow in the heart muscle, left ventricular hypertrophy, or the enlargement of the heart's main pumping chamber, and finally can lead to heart failure or the heart's inability to pump blood effectively. Uncontrolled hypertension can also affect the aorta, increasing the risk of aortic dissection, which is potentially a life-threatening condition. A persistent high blood pressure can damage the blood vessels in the kidney, leading to a condition called nephrologiosclerosis. This can impair kidney function and may eventually progress to a chronic kidney disease or kidney failure. Hypertension can contribute to the development and the progression of peripheral arterial disease, a condition characterized by the narrowing or blockage of the arteries that supply blood to the legs and feet. In smokers, hypertension further worsens the already compromised blood flow to the lower extremities.